Good afternoon, everyone. My name is Cecilia Clarke, and I'm the president and CEO of Brooklyn Community Foundation. Thank you so much for taking time out of your day to join yet another Zoom presentation and meeting. And I just want to welcome you to our sixth webinar, where we discuss some of the most salient needs and issues that are being impacted because of the COVID pandemic. But before we begin, I'd like us to please take a moment of silence to observe the over 100,000 lives that have been lost because of this pandemic, and also to honor the pain and suffering and death of African-American men and women at the hands of police brutality and racial hatred. Thank you for taking a pause. So as I mentioned, today is our sixth webinar. Today we're going to discuss the disparate impacts this pandemic has had on elders in Brooklyn. And we are really delighted to welcome Allison Nickerson, who's the executive director of LiveOn NY, an organization that does advocacy for elders. And she will be joined by our program officer, Sabrina Hargrave. And we anticipate a very interesting conversation, and we certainly welcome questions to make it more conversational. Before we begin, I would just like to do a little background on our COVID response fund. We began this fund on March 12th. We were actually one of the very first community foundations to launch a fund nationally. We did this because we knew early on, in fact, we knew really starting in February, that Brooklyn was going to be hit very, very hard by this global pandemic. And we knew that we needed to get out in front of it. Since then, I guess we've been at this for 12 weeks, we have raised $3.2 million. And so I do just want to take a moment to say thank you to all of you who have donated to this fund. I just can't tell you how moved and grateful we are. This has really been Brooklyn showing up for Brooklyn in a way that we might never have imagined. In addition, we have gotten over $1.6 million out to, which represents about 165 community-based organizations in Brooklyn, working to address the challenges this pandemic faces, and we've been working hard. And we actually, one of the things that I think has been a hallmark of this work is that we've been getting grants out every single week. One of the things we wanted to do right away was to reduce the burden of nonprofits who are already dealing with this immense and unprecedented crisis. The other thing I'd love to say about our COVID response fund that I think is particularly important to say at this moment is that it is very much rooted in our values of racial justice. This is a guiding force in our organization and has been for many years. This was not created for this COVID fund. But when we were starting to structure the fund, we realized we really needed to root it and anchor it in these values. So this fund very much looks to how this pandemic has impacted communities of color in Brooklyn, which make up almost 70% of the population of this borough, and are looking at really community-based, community-led change. And to that end, over 70% of the grantees of this fund are people of color, Many of them impacted themselves by the crisis. This is very much a community-led, community-embedded effort. Over a third are actually organizations with budgets under 500,000. Again, these are grassroots, trusted, community-based partners doing the really hard work to help their neighbors in the face of this crisis. I want to turn it over now to Sabrina, who knows much more about this work than I do. And so I would like to welcome Sabrina and Allison, and I hope you enjoy the webinar. Thank you.
Hi, everyone. I'm Sabrina Hargrave. I'm Program Officer at Brooklyn Community Foundation. Welcome today, and welcome to my home, as it is the reality in the Zoom world. As Cecilia mentioned, the Brooklyn COVID-19 Response Fund was created to address these disproportionate health, social, and economic impacts of the pandemic for communities of color here in Brooklyn. And we support our grantees not only through grant making, but also through capacity building support and advocacy. Our racial justice lens and work in grant making is best defined on our website, but as part of that work, we really do prioritize funding grassroots and frontline organizations that are often looked by traditional philanthropy. And we are committed to these organizations now more than ever. In terms of the fund itself, we are currently providing immediate response grants of up to $10,000, which we're able to award within a week, a rapid process that some of our other foundations are unable to do at this time. And current areas of focus include food access, support for older adults, immigrant communities, people experiencing domestic violence, vulnerable youth, low-wage workers, and other non-traditional workers. You may find a complete list of our focus areas on our website under the COVID-19 grants page. Our communications team does an excellent job of updating that information every week. So we understand that these are urgent times, and we are responding as quickly as we can here at the Brooklyn Community Foundation, understanding that in future phases of our response, we will be providing grants for a longer-term response here in Brooklyn. A note about logistics, just to reiterate, before we kind of jump in, please use the Q&A tab on the bottom of your screen. Should you have any questions, we'll be holding those till towards the end of the webinar. And if your organization or anyone who has a question about receiving a grant from the fund, please email covid19@brooklyncommunityfoundation.org. And thank you for joining us. So diving into older adults and the topic of today's webinar, the Brooklyn Community Foundation is deeply committed to older adults in our borough. Prior to the onset of COVID-19, we launched the Brooklyn Elders Fund this year with decision-making support from older adults in our borough as part of an adult advisory council. Understanding the particular vulnerabilities they face and harmful impacts of COVID-19 on the specific population, we named older adults as a prioritized population when we released our RFP in March. And thinking a little bit about the impact of COVID-19 and just grounding us in a few numbers, New York City has suffered almost 17,000 lives lost to COVID-19. And of that, the bulk amount has been in older adults. Brooklyn Community Foundation defines older adults as people over the age of 50, understanding that due to different life circumstances that aging and other health vulnerabilities may be exacerbated, such as living in poverty or former incarceration. So when we think about lives lost in terms of the Department of Health numbers, they have 45 and older, so I'm going to be using that number, and that has been 96% of lives lost to COVID-19 here locally in New York City, with 74% being over the age of 65. And as part of that, and the organizations that we help support, the fund is supporting nonprofits focusing on Brooklyn's older adults, including the JCC of Canarsie, that's providing case management services and food access to older adults in the hardest hit section of New York City, including Starrett City. Organization, the Guardianship Project, that is providing remote safety and wellness checks, as well as emergency food deliveries for their legal guardianship clients, who are primarily older adults and also individuals with disabilities. Grassroots organization, Home Crest Community Services, that is providing emergency meal delivery to Asian seniors in South Brooklyn in partnership with a local Chinese restaurant. So these are a few organizations that are being supported by the fund at this time. I highly encourage you to check out the complete list of grantees, again, updated weekly at the brooklyncommunityfoundation.org website under the COVID-19 tab. Welcome, Allison Nickerson. The foundation is incredibly proud to support LiveOn New York's advocacy work on behalf of its member organizations at this time. Allison, I'd like to again thank you for joining us to discuss how your organization is responding to the current crisis. Your members are being adversely impacted by the halting of traditional services while facing the highest number of client deaths as a sector. So if you can please start us off by just helping to understand what are some examples of the challenges your members are facing right now?
Sure, you can hear me, right, Sabrina? Okay, great. First, thank you so much to Sabrina, Cecilia, and the whole team at the Brooklyn Community Foundation. We so appreciate your leadership in funding in Brooklyn and in focusing on older people. So thank you for having me, and thank you for your leadership in that area. This time has been immensely challenging. When I think about what CBOs who are serving older people have faced over the last 12 weeks, 3 key things come to mind. The first is really focusing on emerging needs, and that I would break that into 2 areas. So the first is that a lot of CBOs have really stepped up in amazing ways to serve the people who are currently participating in their programs. So seniors who go to senior centers, older people who receive a home delivered meal. There are emergency needs, including food needs, supply needs, communication needs, that the community services and LiveOn members have gone above and beyond. The second area, an emergency need, however, is all of the other people who live in communities. I think one of the things that COVID-19 has really exposed is the deep vulnerability of so many more people than traditionally we think about as users of social service or reliant on the social safety net. So, a lot of times older people who were getting a meal from their mosque, some food from their church, a nephew from Long Island coming in to bring food, are no longer able, once that infrastructure is taken away, are really not able to remain at home and safe. So we're seeing people who were, on the brink pre-COVID and now in COVID, and certainly as we plan for the future, are in a lot of need of support. And so, filling those emergency needs has been a huge challenge. Not saying they haven't stepped up and are innovative, but it's been a truly difficult time. The second key area is navigating, the ongoing bureaucracy of New York City and New York State. I think it's no secret that the city and the state, and for sure the federal government, have been scrambling to figure out what to do. This is an unprecedented time, and the guidances that have come out from the city and the state and the federal government have given conflicting information. They don't necessarily drill down to each issue area, to each social service system. So it's been very hard to understand what the guidances are for the community providers. At LiveOn, we work from a strengths-based perspective, and that is both for the older people who receive services, as well as for the LiveOn members who are running this work in communities. So we believe that there is no one better to understand how to serve the needs of the community than the community itself and the agencies and provider network that's located in neighborhoods. So we've done a lot of work and continue to do a lot of work to meet the challenges and have providers and community organizations themselves raise solutions to challenges rather than being told by the city and the state and the federal government what needs to happen. But that's been a challenge because when people aren't sure what to do, there's a lot of confusion, certainly. The third area I would mention, the biggest challenge is infrastructure, right? So, it's interesting because for years and years, organizations have been wanting to have, you know, services without walls or senior centers without walls, and really provide, whether it's yoga in the park or caregiving services in someone's home, you know, doing out of the box programming. And now they have to, but there's no funding and there's no infrastructure to support that type of work. So it's been a challenge, and certainly philanthropy has done amazing work helping to fill that need and giving providers the ability to do what they know they need to do. So whether that's online classes, phone-based book clubs, to keep people engaged and to reach out to new folks. That is happening, but it remains a challenge, and it remains a challenge as what it's going to look into the future, given the difficulty with infrastructure.
And how has your organization had to pivot to respond to these kind of changing needs of the member organization?
Well, I would say everyone on our team, we have a staff of 12. Every single person is working on this work. So we, you know, we have a direct service component of our work that helps people make ends meet through screening for benefits and entitlements. I mean, they're seeing a huge increase in the number of folks who are coming to them and needing support. We are working with food delivery providers to get food to affordable senior housing, because folks who live in affordable senior housing weren't necessarily included in the city's emergency response to food. And then, you know, really focusing on communication, right? So I think what LiveOn does best is connect providers together. I certainly don't, and you know, I don't think my team would claim that they have all the answers. But together we can work as a team to make sure that what's happening in you know, Coney Island makes the most sense in Greenpoint, and will potentially work in Bushwick. So if we can get together and trade solutions and best practices, that is the way to go. So to that end, we've done a lot of communicating. We set up a work group that meets every Friday to go through, it's part self-care, part updates, and part best practice sharing, so that people can understand, you know, what's happening all over the city and all over their neighborhoods.
Great. And as you know, we start transitioning to questions from others, you know, how really can people on the call help in the advocacy work that you all are doing, and other level of support that LiveOn New York needs at this time?
So, I mean, I think the biggest need that not just the field and our community needs and LiveOn needs, but is really to reframe how aging is seen overall. I mean, there's been a really amazing amount of ageism that's come out in this time, when people talk about deaths that are, oh, they're only in nursing homes, or, you know, the state and their reaction, how do I say this in a diplomatic way, you know, their inability to consider what needed to happen to keep oldest New Yorkers safe is a real challenge. So first and foremost, that work comes from all of us, and how we talk and how we speak and how we consider who is valuable and who is not valuable in our society. So I think that's one thing. And I can certainly talk more about that again, but I think that is number one that needs to happen. The city and the state need to prioritize this population and understand that they need to go to community providers first to get answers, and of course to older people. But the second area, I think, is, you know, we rely so much on our member network, right? Like, again, I don't have solutions other than bringing people together and brainstorming as a collaborative. So the information that I get from community members and from providers all over, certainly our members in Brooklyn, but all over the city, help to fuel our advocacy. So when we can see, okay, this trend is happening, or, you know, several weeks ago, lots and lots of people are not getting food. We had entire affordable senior housing buildings where people were sheltering in place or quarantined, and there was absolutely no medical assistance, absolutely no food. Like, that's where we can step in and say, this is not okay. Let's connect the dots with the right government agency with the right partners, and bring people together. But I don't know that's happening unless people talk to us, right? Talk to a LiveOn member or participate in one of our forums. So I would say the best way to get involved is to really, anyone can certainly reach out to me at any time, or any of our team members, and find out how to give feedback in that way. Because the only way to truly advocate is to have that information and to figure out what the solutions are together.
Thank you. And I just want to remind everyone that if you have a question, please feel free to put it in the Q&A box. We'll be taking a few right now before we close the webinar. But I do think, Allison, it would be helpful to, you said, if you want me to elaborate a little bit later about what you mean about who is important or something along those lines. The audience for today's webinar includes and extends beyond those that work with older adults daily. So I think it would be helpful framing.
Sure. I think, now is the time to think about what is possible, right? So COVID is not going away anytime soon. Across the state of New York, there's consensus that senior services are not opening as they would have in a pre-COVID world until at least the fall and possibly 2021. So given that reality and the risk has not gone away for older people, what do we need to be doing now to make sure that we aren't dismissing people's needs, that we're including what works, looking at all of the pieces. And again, as I mentioned before, providers on the provider side, they have wanted to have out-of-the-box services for years and years and years. Now is an opportunity to say, what is the need? What can we leverage? And how can we make this an opportunity so that we can reach even more people who may have needed services before, but couldn't access them? So, I think I say a lot, and I truly believe it, as we age, we gain an incredible amount of momentum. People contribute all the time, right? As we age, people are contributing to younger kids through tutoring. They're powering up the economy. Older people are a necessary and wonderful part and anchors in our community. So how do we create systems that can respond and leverage that opportunity and not dismiss people as, you should really just stay at home. You really don't need to be considered. So, we have the census going on. We have an election coming up. These are all opportunities that we can affirm that older people are worth investing in and have a future. And the services and the service structure, we can plan now for what that is going to look like into the fall and into the future. There are a lot of areas like broadband, access to, pharmacies that can, there's little policy things that can be enacted. Pharmacies should be allowed to, fill prescriptions no matter where you live. People should be considered a, client or participant anywhere they choose in the city, right? They should have access and know what's happening on the ground and in provider networks. If they want to participate in an arts program or a virtual yoga, like all of that stuff needs to be available. Now is the time to build that infrastructure.
Thank you so much. And I'm going to ask that Cecilia come and join us. And she has been on the back end, maybe has a few questions to add.
Thank you, Sabrina, and thank you, Allison. Allison, I just wanted to know, actually, just in the briefest possible way, what exactly LiveOn does, and it's pre-COVID, and for those who are listening, what is the difference between being an advocacy organization and being a service organization? Kind of what does your work look like? That's my first question. And my second question is, I'm really glad that you touched on ageism, because I've been on some very unfortunate calls where people have said, well, COVID is actually really just, accelerating death that, old people were going to experience. Oh, anyway, I know you're shaking your head, but I've actually heard these very words, and not just once. Which of course is ageism, right? And I love that you talked about the vitality of this. This is the highest voting population. Let's just start there, like how vital that is to our democracy. So I guess I'd love to hear from you just maybe a little more about how ageism has really played in the tragedy that has happened with this population because of this disease, and how, as an advocacy organization, you've worked to confront it.
Sure. So to start, LiveOn NY is a membership-based nonprofit. Our goal is to build power and capacity at the city and state level to make sure that people have access to services, resources, and can thrive in their later years. So we do that through, 3 areas. The first is policy and advocacy. We do a lot of advocating to the city and the state on the budget and legislation. If we buy policy through budgets, they need to reflect our priorities. So we make sure that older people are represented in those budgets and in that legislation. We have an affordable senior housing initiative as part of our policy and advocacy work that represents all of the not-for-profit affordable senior housing developers and managers in the city of New York. And we make sure that affordable housing for seniors is a priority within the housing plan of the city. The second area is workforce development. So we do about 30 to 50 trainings a year. We have an annual conference for about 500 folks, and do a lot to make sure that the professionals in the field have the skills to serve older people now and into the future. And then the third area is direct service. So we work with a couple thousand people a year to help them make ends meet through access to SNAP benefits, the SCREE benefit, HEAP, and now Get Food, NYC, so that folks can, again, make sure that they can make ends meet and thrive in their communities. So I guess the difference between service and advocacy, I think I would say internally from LiveOn, we see them as part and parcel of the same thing. It fuels our advocacy. We know what is happening on the ground, and we know what the priorities should be, both from our member agencies. We talk with them all the time and hear what they're dealing with and what older people are struggling with in communities, and we make that a priority. And we also hear from our direct service team, who can tell us, the city council or the state legislature just passed a new rule on SCREE, the qualifications changed, but of course no one ever knows that happens. So we make it a priority to advocate so that more people can find out about those things, and we kind of do it all together. On
and Allison, I wanted to kind of give you a little bit of an amalgamation of questions and just let folks know that if there are any questions that remain after the webinar, we will revisit and respond via email, since I know that there's limited time. There is a question about, the administration is starting to respond in terms of potentially AC units to people sheltering at home, but maybe many older adults may not use these units because of the high cost of bills. So if you can have any insight as to how to address kind of these responses, but gaps that still exist. In addition to that is also counseling services for older adults dealing with isolations, and particularly those that may not be connected to or previously connected to the senior centers, which was always just a smaller amount of the older adult population.
Sure. So just to go back really quickly, Cecilia, to your question about ageism, I think that it is very easy to dismiss people that you think are an other. And that happens, of course, with race and gender and ethnicity. And also, and I think that, there's more awareness now, which is great, but certainly happens with age. And it's increasingly easy to dismiss people who are not just old, let's say, but are old and a person of color. I mean, those things all come together. People suffer from years of cumulative disadvantage and become invisible, and it is a tragedy, both for communities, because we know that, research tells us that children are healthier when older people are present, right? We know that during Sandy, the stress level of kids in NYCHA buildings went down when more older people were on their floor, right? Just having older people around is good for everyone. And it's also a tragedy when we think about our own trajectory and how we age. It's part of devaluing the self, right? If you devalue older people. So I think it is a major, major problem that we will at some point come to terms with in this country. But during this crisis, it's unreal what I've heard people say. And, you know, it's been a little hidden by the amount of crisis management that the governor and the mayor are putting forth. But it needs to be highlighted, and we need to show how older people, and that's part of our job, and that's part of what we do with other advocates, is to bring forward the issues of not having food, not having access to information, to materials, to supplies. So I think it's a major issue. I don't know, again, I don't have any major solutions on it other than to constantly talk about it and you know, have it be part of the conversation, because it is really there. ACs, yes. The city is investing in tens of thousands of air conditioners for older people. They are organizing it like they did for fair fares. The city has predetermined who is eligible for an air conditioner, and they have started to make calls and install those air conditioners. I've heard a lot of feedback that, number one, many older people prefer fans. Why can't the city buy fans? And that building owners are charging for the air conditioner unit to be simply in the window, which is a major problem. I heard $8, $10, up to $25 a month. We're working with HPD at the city level and the housing organization at the state level to see if there's legislation or rules that can be changed that can be stopped, because that seems like an easy thing to get rid of. If there are a lot of people who need air conditioners and can't get them, they should let LiveOn know what examples they have of that so that we can feed that to City Hall. In terms of the funding for electric, I will have to check back with our benefits team to see what might be possible in that arena. I know there are programs that might be possible for people to access, but it is a concern, and we have raised it with the city, certainly. And Sabrina, I forget the other question.
Good amalgamation.
Could you say it again?
Just a quick note on accessing mental health services for older adults that may not be receiving it right now.
Sure. So the state, interestingly, is now allowing for older people to receive mental health services over telehealth, which has been something that advocates have been asking for many years and is now allowable. So for those services, we can certainly send, I don't know if you have ways to send participants information from this, but I could certainly send some resources out because there is an opening up of what's available in terms of mental health, geriatric mental health, which is a great thing. And then on the, maybe not mental health counseling, but information referral and needing someplace to go to kind of hook in if they weren't a participant of a senior center. That's a really good question. And I think I will have to ask some of our members what the best way for people to get a hold of them is. You know, I know that lots of older people and caregivers are simply calling and asking how they might be involved and might access programming, but there might be a more streamlined way or ways to do that. So I will have to get back to you about that.
Thank you. And we're going to squeeze in one last question because we've been getting a lot of good ones. And this final one, I think you can speak greatly to it, but you know, how are city and state agencies that work on aging, DFDA and others, responding to contracted agencies at this time? Are they overwhelmed? Are they being responsive? And any insight you can give to that?
Well, you know, I wish that the city took a better stance on leaning more on community providers and on their contracted agencies. You know, the city has made a strategic decision for many years to subcontract their services to private nonprofits. And those nonprofits have been doing good work in communities for 40 plus years. And so it is my North Star that they lean on that expertise. Because again, we use a strength-based empowerment model that says that there's no one better to serve the community than groups in the community themselves, assuming they're getting, you know, the right amount of support from government agencies. I think, you know, the state is tricky. The state, we are in a home rule state, which means that the state defers to the county. So I would say the state is not as responsive to the community providers because they're assuming that New York City is going to be the first line that providers need to go through. We're trying to figure out some ways to get around that, to get information directly from the state to nonprofits. From the city's angle, it's been a bit of a struggle. I know City Hall is doing a lot to increase the feedback from nonprofits and leans a lot on umbrellas and membership groups like Livan to feed information to them. You know, DFTA or Department for the Aging is a very small agency in the scheme of things. And it's been a challenge to make sure that everything's on the same page. And again, this is an unprecedented time. So we at LiveOn do our best to make sure there is shared information and consistent information so that the nonprofits don't have to spend their time wondering about contracts and directives, instead focusing on the community itself.
Thank you so much, Allison, for your time today. We really appreciate your expertise, and all of those joining on the webinar today that are older adult service providers. We really appreciate your time and the work that you're doing. I'm going to hand it over to Cecilia at this time to close us off. Thank you.
Allison, thank you so much. Really, really appreciate it. Please, I would encourage everyone to go and look at the work of LiveOn. If you have the chance. Sabrina, thank you so much, as always, and for the work that you do in our elder space. I also want to thank people that the audience does not see, but are really doing the hard labor behind these webinars. Jamila Syed and Jenny Walski, thank you so much for doing work on these weekly seminar webinars. And then finally, I just want to close out by saying that lots of people have come to me and said over these past 3 months, you know, I want to help. I know COVID is hitting Brooklyn hard and I want to help, and I'm interested in elders, I'm interested, and it's overwhelming. And I understand it's overwhelming. I mean, it's an embarrassment of riches that so many organizations are doing such good work, such as yours, Allison. And so one thing I would just say, and of course I've said in response, is it's actually remarkably efficient to support our COVID fund, because we will get it out, and we will get it out in a timely way and in a fair way, and in a way that really regards racial justice as the driver behind a fair and just Brooklyn in our work. So I guess what I would like to say here in closing is, if you haven't already given, or maybe if you have given, please consider donating to the Brooklyn COVID Response Fund. 100%, literally 100% of your dollar goes back out to extraordinary organizations like Allison's, like the 160 organizations we've been funding. We are doing it efficiently, and we are doing it in a way that really considers racial justice in all of our work. And so I hope that you will consider donating to this fund, going to our website and donating to this fund. And in addition, though, if you really just want to single out some organizations, please take a look at our list of grantees. It's an extraordinary group of organizations, many that you probably haven't heard of, and I just think it will be so interesting for all of you to take a look. So again, thank you all for joining us. Thank you, Allison. Thank you, Sabrina. Thank you to the rest of my staff, and have a great afternoon. Thank you.